So we're in actually East Lansing right now. We go to Michigan State University.
Cool.
I go to
And
Michigan State.
Nice. That's awesome.
yeah. So it looks like we're live now.
Awesome.
We'll give it a couple minutes for people to start joining, and then yeah.
Sounds good.
So we're in actually East Lansing right now. We go to Michigan State University.
Cool.
I go to Michigan State.
Nice. That's awesome.
So it looks like we're live now. Yeah. So Deepika, do you want to mute your YouTube live so that we don't
Yeah. Just give me one second. Okay. I'm just waiting for a couple more people to join.
Sure, that's fine. Do you want me to pull my screen up yet or no?
I think you can
Just
pull your
wait.
screen up after I introduce you. It would just
Okay.
be in a couple minutes.
Yeah, no, that's fine. No problem.
All right, I think you can go ahead and start now.
Okay. So hey everyone, welcome to our virtual shadowing session. Today we have Nichole Giller, RDN, who's an oncology dietitian, and she has a presentation for us today. And just as a reminder, we'll provide you with the link to the Google Forms, and you'll have a total of 30 minutes to complete it once you've gotten it. And you can type your questions on the YouTube Live, and I will send them directly to Nichole Giller.
Awesome.
Okay, we can start.
You want me to go ahead and screen share now? That's fine?
Yeah.
Okay, cool. Let me do this. Okay. Pull this up. Hold on. share. Some myths and misconceptions. Okay, so it's trying to share my screen now. I don't know why it's not going. Let me try one more time to share this. It's right there. I don't know why.
Do you want me to make you co-host, unmake you co-host and then make you co-host again?
Okay, so let's try this again. It does say my internet is unstable, so that's why it was being weird. So I think there was a chat. Okay. Cool. So how do you guys want me to answer the questions? Throughout is okay, or at the end? What's best for the group?
So I think you can take it however you want it. So I think if you want to, you can share the presentation, and then throughout you can answer some of the questions.
Okay,
I'm just going to put the questions in the chat as we go.
Awesome. Okay, cool. I'll probably do it just as we go because I like that.
Okay.
Yay. Okay, cool. Okay, hello. And it's sharing okay? Thumbs up. Is sharing good? Okay, cool. Okay, hello everyone. My name is Nichole Giller. I'm an oncology dietitian. Thank you so much for having me. Okay, so my medical message, I'm here, I'm in the USA. I run a private practice. I've been an oncology dietitian for 10 years. So I'm an expert in nutrition for oncology, for cancer patients. Nutrition makes a huge impact for cancer prevention, during cancer treatment. During cancer treatment is a huge part of what I do because ultimately cancer patients will it'll make or break their treatment regimen if they have the proper nutrition. Like my full goal is to be, we want to fulfill the oncologist's prescriptions to kill off the cancer. And really you cannot do that unless you have proper nutrition. So I love being an oncology dietitian because nutrition is so powerful in this group, or in this setting. Okay, so let's go through I know there's questions and I wanted to answer them so far. So the first question was, I want to ask myths and misconceptions regarding food and cancer that need to be debunked. What should be people's actual approach? So yeah, that's a huge part of what I do. I actually really love it because, and you guys may be able to relate to this, but I love science and it's really great because the facts are not opinions. And so it's actually pretty easy to educate people once you have the science down. And as you're studying and, becoming a dietitian or working in the oncology field, maybe you'll learn over time how to debunk these myths. So honestly, when you say what should be people's actual approach, I would just let them know the facts and be pretty straightforward. I feel like that's the most effective way. For example, like sugar feeds cancer is like the biggest myth ever. And it leaves a lot of cancer patients really paralyzed to move forward and eat. So really just being straightforward with them, using the facts. For example, yes, cancer does have a higher uptake of carbohydrates. That is true, but it also has an uptake of other nutrients as well. And we cannot slow the growth or speed the growth of cancer with nutrition. So, that's just an example of just using the facts and being straightforward is really the most effective way to ease their concerns. Okay, let's go to the next slide here. Okay, so becoming an oncology dietitian, This is just a little bit about me and my journey. You know, to get a dietetics degree, you have to, your undergrad, I believe now they require your master's. When I went through it, it was just a bachelor's of science. And then also a coordinated program in dietetics. And basically it's an internship. So once you graduate from your undergrad, getting your master's as well, then you go on to do an internship. So you're paying money to do more work, which is fine because you get a lot of good experience. So that's usually another year. So to become a registered dietitian, it usually takes about 5 to 6 years. Some go on to get their PhD. It really kind of depends on what your preference is. I did not. I got my bachelor's in science, did my coordinated program, and then I went right into it. I worked in oncology my entire 10 years career, and I kind of fell into it. So my first job was at a hospital. I worked the oncology floor, and so they were all inpatient, and a lot of them were newly diagnosed. And so if you work in oncology or as a clinician, you'll see that most cancer patients who are newly diagnosed with cancer have extreme weight loss. That's usually a huge red flag. Basically the dietitian is in need right away because the metabolic changes in cancer patients, some of them, they cannot be repaired. You cannot improve nutrition status. And so that's why you want to get in there as the oncology dietitian right away to support them. Because like I said, it can make or break the treatment to kill off the cancer and help them survive. So I just saw right away early on in my career with oncology nutrition is that the dietitian is completely essential. It's just very powerful. So it's such a team effort in oncology. That's why I love it. And nutrition just really will, it'll save lives when it comes to cancer patients. The other areas I worked in, I did survivorship clinics. So what those are, there's just so many different areas you can work in oncology. So the pediatric survivorship clinic, pediatric cancers are, they don't really have many risk factors. They don't really understand why they get so many of the pediatric cancers. So unfortunately, during these developmental years, they get these chemotherapies, and it really, really, really impacts them into adulthood, not only physically, but also psychologically. So just really helping them, navigate through health and nutrition and cancer prevention as adults was really powerful. And I see that a lot, that people don't understand pediatric cancer patients, like their mental status is just never the same after getting these chemo drugs during these really essential years. And that was just huge as far as, just educating the family, like, hey, because of these things that happen, to your child, it's just not going to be the same as they grow as an adult. And then adult cancer survivors, that clinic was when they were adults, older, and had chemo, radiation, all this, and then they wanted to work towards cancer prevention. Breast cancer clinic, I specifically work with breast cancer survivors, radiation therapy, all different types of cancers there. It really depended on their nutrition status and which factors. As an oncology dietitian, you will not see everyone in the inpatient setting. There's too many patients. However, like I was already saying, nutrition makes such a big impact. It's definitely something that really every patient should be seeing the dietitian. More importantly is to make sure to have ongoing nutrition support to those high risk cancer patients. Like for example, lung cancer, that's a high risk one for sure for malnutrition. Gastric cancers, patients who don't have a stomach, they need to be seeing the dietitian ongoing. And I think where it falls apart, in the cancer clinics with the dietitians is they're more reactive than proactive. And that is why I have my own private practice, because I've kind of changed the way I provide support to cancer patients. You don't want to wait until it's too late, because like I said, metabolically, what happens to cancer patients, you may not be able to get their nutrition status back up, and then they would fail their treatments no matter what you did. Okay, so let's do another question. How did you decide to specialize in oncology nutrition? Do you consider any other fields along the way? So I really just fell into it. Nutrition was always of interest to me. I really enjoyed science. I kind of looked at the other areas of healthcare, and it just didn't interest me as much as nutrition. So that's really where I got into it. And then oncology specific, I didn't even know until I had that first job where I was inpatient. and I just saw how much it makes an impact for the outcomes, the treatment outcomes. But then also, I think it's sort of my personality. I have, you know, I want to help others. I have an empathetic nature. So you will see when you work, if you work in oncology, you will see this is such a vulnerable population because their cancer essentially, I mean, yes, nutrition, physical activity has a huge impact on cancer risk, but a lot of the times it's not their fault. And they're up against these crazy treatments, and they're scared, and they feel, you know, there's all this misinformation around nutrition. So you're really able as an oncology dietitian to be a really big support system to help ease their concerns and anxieties around food. And just for me, I knew I wanted to do that. I was just good at that. And it's very rewarding to see them, you know, use nutrition as a tool versus something to be afraid of. Did I consider any other fields along the way? Yes, I was a renal dietitian for a while. That one was tough because those are usually non-compliant patients. You know, they're at dialysis because they did not regulate their blood pressure or their diabetes. So that wasn't as appealing to me because, you know, they were non-compliant, and I wasn't really as interested in that. Also, I looked a little bit into, a little bit into diabetes, but again, it just didn't interest me as much. Again, I felt like it was a lot of just unmotivated patients. So I just, with cancer, it wasn't necessarily their fault, right? So it was a population I wanted to help. Do you treat patients in different age groups? What are the differences of their diet plans? Well, currently, no. In my private practice, it's all adults. But yes, there is a difference. Like if you're a pediatric oncology dietitian, you are treating the patient who is the child, but honestly, you act as like a protector because what ends up happening, which makes sense, is the families have so much anxiety around their child going through cancer, is that the misinformation then goes to the parents, and then the parents may push nutrition in a certain way onto the child, which can create anxiety to ultimately your client, your patient, right, is the child. You know, they're pushing on certain myths or certain food to these kids where and what I've seen happen is they grow up and they have eating disorders because their parents were so worried about cancer with their child, worried about nutrition. So really, yes, when you work with pediatric cancer patients, you're really working with the family, and you're really educating them and showing them, you know, about the myths and sugar does not feed cancer. That one's a harder one personally for me. And yes, I've worked with pediatrics for a while, but not as much as I have with adults. The cancer prevention recommendations, which are supported through the American Institute for Cancer Research, those are the same for everyone. So whether you're pediatric or an adult, it's really recommendations for everyone for cancer prevention. So those diet plans don't change. Okay. So does your diet plan change for patients with different types of cancers? Yes. Oh, yes, it does. For example, how might you approach a diet plan for a patient with breast cancer versus one with colon cancer? Absolutely. Okay. So good news, research, I'll try to kind of say this simply. So the World Cancer Research Fund also works with the world, it works with all populations for adults all over the globe, and they collect data. And there's what's called the Continuous Update Project. So they reevaluate thousands of studies related only to cancer prevention every 3 years. So that's really important to know that it's up-to-date research. And then they compile together what is the strong or limited evidence to reducing risk for each specific type of cancer, okay? It's really amazing. So the American Institute for Cancer Research, those are the recommendations I use. I'm in the USA. So I go to the American Institute for Cancer Research to find out what's the latest recommendations. So they are different for every cancer, like I said. For breast cancer, for example, to reduce risk would be to make sure you're physically active, do not drink alcohol, more plant-based plants, and actually the recommendation is to have more soy for breast cancer, which usually everyone's like, what? Because there's misconception around soy increasing risk for breast cancer. And that is not true because soy is a plant. It is not human, it's not female estrogen. It's just not. So it's actually interesting that soy is recommended and it reduces risk. And then for colon cancer, like their recommendations that were found through the CUP were more plants, more physical activity, and no alcohol. So you can see some are crossover, but there's specific strong evidence to show certain lifestyle patterns will reduce risk. It's very cool. It's very powerful. The World Cancer Research Fund has done a great job. And like I said, they update those every 3 years. So you're making sure to give your clients the most up-to-date information. And it also gives them something to focus on. You know, if maybe for breast cancer, it's to eat more soy, that's something that they can you know, they can consider doing versus, you know, something else that's, you know, false. Like for example, turmeric is really big in the oncology community, but really it's a spice that you can add to your food, which may be anti-inflammatory, but it's not going to have as much of an impact as, you know, having more plants or being more physically active. So as the oncology dietitian, what's so awesome is that you're able to take the science and bring forward the, you know, what are the recommendations that really matter most, get your clients and your patients to start there, and then work down to these other little details of turmeric or this or that that maybe not be as necessary. Okay, so what do I see? Cancer patients I see day to day, I see all types. So the therapies they're going to be undergoing is radiation, chemotherapy, immunotherapy, surgery, or hormone therapy. Hormone therapy is 5 to 10 years. That's very long. That's long ongoing. The first 4 listed here, really, you want to make sure to avoid malnutrition. That is your #1 goal as an oncology dietitian. And then hormone therapy is after those treatments. You can work towards weight loss with hormone therapy. And then finally, survivorship. And basically what survivorship is cancer prevention using those guidelines supported by the World Cancer Research Fund. So that's what I see. And all adults, I see all adults and different stages, and I see them throughout the stage, which is super cool. You know, I'll be working with a client during cancer treatment, and then we'll move into cancer prevention afterwards. Am I just on that? Yeah. And it's different. So that's the other thing that's really powerful and fun about being a dietitian is that nutrition recommendations during cancer treatment for different types of cancers is going to be different than after cancer treatment. So for me, I love that because there's a change in what we talk about and new goals. So I love that part. What are the differences in their job? Okay. And then also, metabolically speaking, during cancer treatment, they're going to have different metabolism. So some patients will be hypermetabolic, hypometabolic, or there won't be any metabolic changes. So you have to, you know, really change up calorie protein needs to make sure they maintain weight, because that's going to be your best indicator to avoid malnutrition. And like I said, the ultimate goal is to follow the oncologist's prescription to kill cancer. And you can't do that if you're malnourished. So as the oncology dietitian, we focus on avoiding malnutrition, which is not that easy if you're running up against like so many different side effects, which they are: nausea, vomiting, diarrhea, constipation, mucositis, indigestion, low appetite. There's a lot of things to manage as a dietitian. There's a lot of things you can do to really help them still eat. So what roles does the diet play specifically during the treatment and not after that? Okay, so I kind of just explained that a little bit. So avoiding malnutrition during cancer treatment. So we're not working on cancer prevention during cancer treatment. And that's a big confusion piece. It's just most of my clients are really confused on that, because what happens is someone gets diagnosed with cancer. So their first thought, pretty much like 99% of the time, they're like, okay, well, how do I prevent cancer? Hey, it is not the time to prevent cancer during cancer treatment. You have to get through your treatment. You already have cancer. You know, you obviously would want to, you know, portray this in a delicate way to your clients or your patients, but like, you already have cancer, you know, it's too late. So you need to get the treatment to kill it off. And then we work towards cancer prevention. So I always encourage them to, you know, not have food fears. We don't want to develop eating disorders during cancer treatment from misinformation. You know, you keep them to the evidence, the science, you avoid malnutrition. If they feel so terrible from their side effects and the only thing they can tolerate is ice cream, you are there to let them know that that is 100% okay. We don't want them losing weight. We don't want them getting malnourished. That's the best way for them to feel their best going through chemo, because ultimately they're being poisoned to a point where they're not going to die. So obviously they're going to feel terrible on these chemotherapies. So your job, or my job, is to really make sure they still eat and feel as good as they can and have their quality of life as good as they can through giving them enough nutrition. Okay. What do I love about being an oncology dietitian? The impact that nutrition has that's what I noticed right away. I do remember seeing patients that were malnourished, and it's basically like watching them die. It's very sad. So, and like I said, there's becomes a certain point, and what you'll learn from your studies, it's called cachexia. It's a point of malnutrition that you cannot recover from. And they've done a lot of studies on how to try to fix that, and you just simply can't. It doesn't matter how much the patient eats. They're just at a point of malnutrition that they can't, like I said, they can't recover from. And a lot of the times those patients die. And so you need to make sure to be ahead of the game and being proactive with nutrition. You will save more lives. And it's great because the doctors are totally aware of this too. And you really work as a team. That's why the oncology dietitian is so essential, because they're the medical experts, but you're the nutrition expert, but you both, are vital for the patient's success. I do enjoy easing food insecurities, disordered eating patterns. I cannot tell you how many cancer patients, hundreds, that I've talked to that have been afraid to eat. They will be hungry and they will choose to not eat because they are afraid of food. And that is really powerful, how the misinformation gets out there. So it's our job, and we're lucky, as an oncology dietitian, to be able to ease those concerns. It's very rewarding to help people be confident in their food choices and enjoy food again, because that's something that a lot of us without cancer may take advantage of. We don't worry, as much as they do. Like I said, they'll skip meals because they're so afraid. I like to bust nutrition myths, and then just supporting a vulnerable population. For me, that's just very fulfilling. Okay, so let's do more questions here. So what is the process of attending to a cancer patient that is struggling to consume meals after chemotherapy and hormone therapy affects their appetite and their taste? Right. So as an oncology dietitian, you're going to have tools and recommendations for each side effect. And it's not uncommon for them to have multiple side effects that you're trying to navigate through with recommendations. It's very individualized. Yes, there are tips and tricks, but you really have to meet with the patient. So like, for example, if they were going to affect their taste. So here's a couple examples as an oncology dietitian. Like if they have reduced taste, like the altered taste buds, using like gum, mints, lemon, spices, spicing up certain things in different ways. Like for example, altered taste will happen a lot of time with red meat during cancer treatment. So you work with the client or work with the patient on how you can dress up those foods to make it more appetizing or just bring out the taste more. Dry mouth is going to be a problem too. So like the chewing gum or sucking on like mint candies will help to bring out more saliva, which will help to bring out more mealtime or more taste during mealtime. Because if you can't taste your food, if you've ever been sick, really sick and you just can't taste your food, you don't want to eat either. So it's relatable in that way, but they need to keep eating. Sometimes, and I kind of don't know how I feel. Sometimes this works and sometimes it doesn't. You encourage your patient or client to think of food as part of your treatment regimen. You don't want to take the joy away from food, but at the same time, they need to make sure they're eating. So sometimes that will be an effective strategy to encourage them to eat. Hormone therapy. So hormone therapy, what I've noticed mostly is they're dealing with their hot flashes, just the changes in, it's not so much taste change. They're more, they just feel different as a person. And really with hormone therapy, what I see is the best approach for them is making sure to include physical activity and, finding ways for them to be physically active in a way that they enjoy really helps. A lot of pain, like joint pain is a big one. Right now, there's not any evidence to show what can help cancer patients specifically to joint pain. Collagen powder is kind of a big thing right now for joints, which has been shown through studies, but not specifically for cancer patients. So what type of foods do you generally recommend to someone with cancer? So during cancer treatment, there are no foods off limits. It's very important to send that message so they do not create food fears and they get through their treatment. Remember, as the oncology dietitian, we want to get them through their full prescription, because you will start to see your clients missing treatment and they're not eating well. Their fatigue is going down. They're not moving. They're moving less. Like, you got to keep them eating and moving. And that's what's going to keep them strong to keep coming back to treatment. After cancer treatment, the big things I emphasize is more plants and more movement. I do not recommend, there's no evidence to say you have to be vegetarian or vegan to reduce cancer risk. You don't. And also vegans get cancer too. So Really, vegan and vegetarianism is a personal choice, which is still fine. But the recommendations from the World Cancer Research Fund just says to limit meat and to build a plate more with grains, plants, nuts, seeds, beans. Those are going to be more cancer preventative. So you still can have red meats, you still can have fish, chicken, all that. You just want to make sure your plate is mostly filled with plants. And like, you can't just tell someone. That's why I really think private practice is best for cancer patients, because you give ongoing support. I see my clients for 3 to 6 months at a time. Whereas like in the hospital or clinic, you're going to see them maybe like once for 15 minutes. They're not going to be able to build or sustain those goals. So I'm just a big believer in ongoing support to give people actual results. Okay, so work schedule, kind of go through these real quick. Inpatient, it's really up to the hospital. If you're an oncology dietitian, a lot of the times you will have the opportunity to build a cancer clinic if the hospital already doesn't have it, and then you can instill different rules. But in inpatient, they're not going to be there as long. You're not going to be able to support them long term. So yes, you can help them while you're there, but it's very short. I don't think it's effective for nutrition at all. Personally, I did it and I couldn't make any lasting outcomes. So you could definitely be an advocate and support system for them while they're in inpatient, but setting them up with an oncology dietitian outpatient is going to be the best for long-term success. Cancer clinics are super fun. I really love cancer clinics because like the survivorship program, you do see them ongoing, and you do see these pediatric cancer patients grow up and come back to the program, and you're able to follow up with them. I love that. Also with radiation or infusions, you're able to, again, follow them ongoing. So you're able to watch them throughout this process and get on top of those side effects and check in with them. Like radiation, you're checking in with them every day. So that's really powerful and effective. So cancer clinics are an awesome place to work as a dietitian. You can work full-time to part-time. It really depends. I love it. The cancer clinics are awesome. And then my private practice is what I do, which ultimately I love. If you're an entrepreneur and a go-getter, I would encourage private practice. There's a huge need for nutrition, just beyond inpatient for cancer patients. A lot of the times, I just had a call this morning with a client. They read that nutrition is important with cancer, but no one's ever really talking to them about it or following up about it. And the oncologist doesn't know all the information, doesn't know the research with all of the nutrition information. That's what the dietitian knows. So they really need a specialized ongoing support. So private practice is my vote. Okay, so questions. How does that vary from my diet plan of someone who doesn't have cancer? Yeah, so technically the American Institute for Cancer Research recommendations are for all adults. So you and me too. So for cancer prevention, the general recommendation is to eat more plants and be more physically active. It's not as flashy as like the turmeric and this and that and all these myths. And that can be very hard for so many of us to include more plants and to exercise more and to enjoy it. So there's so much work to be done there. And then how do you treat cachexia? Yeah, you can't. So you want to try to get ahead of it. And how to get ahead of it, sometimes that's a hard one. I work with your oncology team on that. That's hard. You can't. And they're doing a lot of research on that. Be proactive with your patients, advocate as an oncology dietitian to make sure everyone's screened for nutrition, stay on top of those patients. Like I said, they can not come out of cachexia no matter how much they're eating. And it's a very scary place for them to be. So work with your team and be proactive. How does pediatric oncology nutrition differ from adults? Right, so pediatrics, their recommendations, there's not as much research there, but the recommendations for protein and calories is going to be different because they're at a rapid growth state, but then they're also up against these very potent drugs. Pediatrics do not have as many side effects, or they're not as severe. They don't know if that's because of just they don't know what's going on as much, versus an adult being like, okay, I'm getting chemo right now. I'm about to get nauseated, but it seems that they tolerate the side effects better, but they are rapidly growing. And so you want to make sure to stay on top of their calories and protein, and really just working with the families so they don't create any anxiety of food around the child, because that's common. How often do cancer patients meet with you over the course of their treatment? Well, they should. For my private practice, it's once a week, which is sufficient. And then they have open support. How my program is ran, they have open support in between that. Once a week is probably minimum. I'd say once a week, that's sufficient. And then if they have, you know, extra concerns, they can reach out to you and you can navigate there. Because if you think about like in a week-long period, if a cancer patient is on chemotherapy, you know, the days they're on chemotherapy, those 3 days, you know, Monday through Wednesday, and then transitioning off Thursday to Friday, they're going to have different side effects and have different battles. So weekly is good, but checking in with them in between as they need is essential for success. Okay, so let's go through, there's more questions and there's really good questions. So let's go through a little bit again with my slides. I wanted to talk about breast cancer. It's Breast Cancer Awareness Month. I know we're at the end of the Breast Cancer Awareness Month, but I still wanted to kind of focus a little bit on that. These are, how do I like do that? Okay. So the breast cancer treatment challenges, like I've been saying throughout, you know, the cancer clinics or private practice is going to be the best way to provide ongoing support. So just with any goals in life, you know, like ongoing support is going to give you success. You can't just talk about your goals one time and then expect to get them done. So same goes with nutrition status. You want to follow up on your breast cancer clients or all your clients really. So these are some of the common issues I see with breast cancer. They're very common. So breast cancer is common just in general. I believe like 1 in 8 women are diagnosed with breast cancer. So the first area I want to talk about is chemotherapy and radiation. They can get their chemotherapy followed up by their radiation. A lot of these are the side effects that they're up against that impact nutrition. So decreased appetite, nausea, vomiting, fatigue, emotional changes, constipation, diarrhea, mucositis, which is basically like their mouth has a bunch of sores. So if your mouth has a bunch of sores, it's difficult to eat. Like for example, with mucositis, you know, one of the recommendations that I work with is using a straw to be able to drink your nutrition and then being able to, you know, work around the sores. It is just so challenging for them to eat with mouth sores. Even like water will burn their mouth. And then taste changes. So you can even have all of these side effects at once. So you can imagine how difficult it would be to eat, giving them small manageable goals. Like right now, I definitely am saying a lot, but when I'm working with my clients or my patients, it's definitely a lot more simple than this. And the biggest thing with breast cancer patients is the misinformation. The soy feeds cancer, the sugar feeds cancer, or soy causes cancer, sugar feeds cancer. You know, I get asked the question a lot, well, what foods are going to increase my hormones? None. There's no foods that actually increase your hormones. For breast cancer risk specifically, it's mostly with adipose tissue. So that's fat tissue. That is what actually creates more estrogen. There are no food choices that increase your estrogen. Exercise actually will help reduce it and reducing fat tissue. When you're balancing out all these side effects with your clients and your patients, it's definitely a game, you know, because they can even alternate between constipation and diarrhea. So you're changing their food intakes to make sure they avoid malnutrition, but then also can still eat around their side effects. So it is challenging. It's definitely some troubleshooting. Surgery, so lymphedema is a huge concern. There's new research to show that physical activity will help improve that. And that's a huge component for breast cancer patients, reducing risk for lymphedema and managing that. So that's a really awesome part about being a dietitian is I help with that. And then hormone therapy, like I said, they're on those for 5 to 10 years. Really bone health, weight maintenance, physical activity is really big, and they need ongoing support with that. So the big thing I hear with oncology or cancer patients is once treatment's over, they pretty much just feel like they're lost on their own. So that's another reason really like why I like private practice, because you're able to be there for them and support them, because you really are. I mean, think about it. They're going to these treatments like every day for months or weeks. They're talking to their doctors all the time, and then all of a sudden it's just over. And they're like, you know, they never go on. It's never, they always say, well, you're done now with cancer treatment. You're done. So back to normal. It is never like that. And that's actually a huge emotional part that I work with my cancer patients, because even their families are like, well, you're done with treatment now, or your cancer's over. Like, no, now they're going to have their scans forever and have scan anxiety. You know, like there's just so much support there to be done. Okay, so more questions. Are there other specialties besides oncology nutrition that emphasize nutrition for patients? Yeah, mean, across the board, kidney, hearts, pregnancy, everything, weight management, diabetes, you name it. Dietitians, absolutely. It's like never ending. What positive outcomes can cancer patients see from working with a dietitian? They can attend all the treatments to kill their cancer off. They can feel better during cancer treatment. The side effects will be less severe. Reduce food anxieties, being able to nourish their bodies with confidence. Post-cancer treatment, reduce risk for recurrence, overweight and obesity, and not moving, no movement. It's going to increase risk. Breast cancer survivors have better survival rates if they're able to be more physically active after. So it's key. And as the oncology dietitian, you are the expert on all this nutrition information. Nobody has the access to it like you. That's your main job. So just remember that you're the expert and you're such an essential part. So what I usually end up seeing is the doctor or friends or whatever are giving little tidbits of nutrition information, but you're really the one with the expert with all the information to, hey, this is what's evidence-based. So that's why the dietitian can get in there and really make, just reduce fears and be effective. How do you personalize diet for cancer patients? It's really based on the individual, actually. So when I look at a cancer patient, number one, okay, what are the weight changes? Number two, what's their type of cancer? Are there metabolic changes? You get them the physical assessment. How are they eating? And then also you just look at them as an individual, like just who they are, how they like to eat. Do they like to eat 5 meals a day? Do they like to eat 3 meals a day? Do they like to walk for exercise? Do they like to bicycle? Because you can't just go to someone, you can't go to everybody with the same plan. You have to actually what is this individual? How do they like to eat? What's their background? That's really how you treat a patient truly. What are your decisions based off for their diets? World Cancer Research Fund, American Institute for Cancer Research, other journal articles, everything's evidence-based. Yeah, I don't provide opinions because no, we just stick to the science. How much counseling and psychology is involved explaining their new diets? A lot, like 50%. So you're not a therapist, but the fastest way for someone to not listen is to just give them a handout. Don't do that. You must get to know your client and your individual, and you must listen. A lot of times clinicians, and I used to make this mistake, you come at them and you just drive home 15, 20 minutes. Here's your plan. You give them the handout and then you leave. They did not absorb anything. Really, to be most effective, to give real results, you listen to your patients and their concerns. And then, once that's done, then you give them goals, to work on based on the issues they're having. And I made that mistake. I would tell patients what to do for years and give them handouts, and I wasn't doing anything. So, really just listening to where their heart is at. Maybe they don't even have any food fear. They just want to exercise more, or maybe they exercise fine. That's not an issue, but they're so worried about sugar. You see what I'm saying? You just got to listen to them and then meet their needs where they're at. So we really talked mostly about the general tips to become an oncology dietitian. Just remembering that you're the expert and it's a team effort. Oncology is it's a great place to work because we're all working towards helping the client, helping the patient. I love teamwork. And then always explaining things that are simple. Don't feel like you have to. I never cite articles ever to my clients. Don't do that. Just, simplify for them. You don't need to, one thing I think I've learned is I felt like I had to be very textbook when I would explain, well, let me tell you about, the Krebs cycle or whatever. That's great that we understand that as clinicians, but we don't talk to our clients like that. We really want to ease their concerns and know that they're making good choices and that sugar does not feed cancer. We don't need to tell them every metabolic pathway around that. And then it can make or break a treatment regimen. Okay, so these are the main pain points for cancer patients. I've really talked about a lot of this: food fears, side effects, misinformation, and physical activity. Really, I'm going to every one of my clients with these in mind to really help to support. Food fear is huge. And maybe some of you have heard some of these myths. Like alkaline diet is another big one, changing your blood pH to impact cancer. No, we cannot do that. You know, our kidneys and lungs help to regulate our blood pH. So there's so many myths around there. And even when I started this is another thing. So when you start out, maybe you won't know everything at first, and that's okay too. I didn't, you know, I had to look up a lot of stuff for a while. You know, you're not going to graduate and be an expert right away. But that doesn't mean that you don't have all this great information. I've talked with other dietitians that, you know, got their first oncology job and they were really worried about being prepared. But you're so much more prepared than the other clinicians because you are the expert in oncology nutrition. So try to take that confidence in, and then you'll just learn how to talk with patients better as you go along. But yeah, I definitely hear that a lot from other dietitians. They're worried about not knowing everything right away. Nobody knows everything right away, but you went to school for this, so you will know a lot more than most. Do you think your job is emotionally draining? Yes, sometimes, but it's kind of my personality is that I pick up on the emotions of others. So it's not as draining for me. It's almost like it's good. But it is hard. I don't know how to explain this. Like when you work with a patient and they end up dying, you know, that's hard. That's really hard. But it also could be fulfilling. So I think maybe where I feel is frustrating for me is when your clients, like in my private practice, they have to be emotionally ready to invest, you know, their time into their goals. And sometimes they're not ready, and they're not meeting their goals, and they're not getting towards cancer prevention. And that's a bit heartbreaking because they're just not ready, and you can't help them. And you know, they're making mistakes to, you know, hinder their health, or they say they want to reduce, you know, risk for cancer, but they're not choosing themselves to prioritize. And that's a little bit hard. But then what I do, so I don't, you know, get stressed out, is I just focus on the people who do want to get better, the people who do want to work with me. So I have to focus back on, hey, some people are ready to work towards cancer prevention, and we have to keep focusing back on them. And the same thing during cancer treatment. So I have one client who was just eating like no protein. You know, they were like eating, you know, grape soda every day. And I'm like, he was in radiation. I was like, you're going to have to eat more. I was even like, let's put some protein powder in your grape soda. And he just wouldn't listen. You know, and so you just have to go back towards the other clients or patients that want to listen to you, you know, and you can't save everyone. You know, some cancer patients are smoking, you know, in between the radiation treatments. I mean, it's crazy, right? So like I said, just go back to the patients that want your help. Okay, let's see what else. I think that was about the end of my presentation. This is kind of a summary. Are you wanting to work in oncology as an oncology dietitian? Here's kind of some tips. You know, this is really what it's about in summary. If I could summarize the last 10 years, you're improving their quality of life. Cancer patients will have reduced mortality. You know, if you're there with nutrition to help keep their nutrition status up. Because keep in mind, like, so cancer patients are so focused on the cancer, right? But we don't want to forget there's still healthy cells. So once cancer is killed off your body, the body will just get rid of it, but not your healthy cells, those stay. And so it's very important to remember, like, there's still a person there. There's still parts of this body that does not have cancer that needs nutrients. So a lot of the times people get hung up on how to starve the cancer, how to get rid of the cancer, but they forget about the healthy cells, because once treatment is over, how they heal and how well they heal. Like there was a study done with radiation patients who had better nutrition status during radiation. They did better for healing versus the ones that did not work close with the dietitian. So nutrition is going to be important to help with the healing process and just reducing risk and, you know, being able to feel better once treatment's over. Educating with science. I love that, using science, because, you know, that's what it's there for. It gives us the facts that we can deliver to help reduce risk or improve outcomes. I love it. It's not opinion based. A lot of people have opinions. I do not like anecdotal stuff. It's like, no. So that makes it easier for me personally. I love science. Being an advocate, sometimes people will not, well, Sometimes they're not going to know the reason for nutrition or why it's important. So as the oncology dietitian, you get to educate the team like, hey, no, actually, I want to improve outcomes. We need to you know, we need to emphasize protein, emphasize calories. Let me see this patient more often to improve their outcomes. And it'll pay off, and it's very rewarding. You will be doing a lot of education that may seem like over and over again. I talk about sugar feeds cancer every day in my private practice. I do not grow tired of it. I understand that for them it's new. So just understand that you'll be repeating yourself a lot. It's not a bad thing. It's difficult when they've heard it 1,000 times. You're just going to have to really educate them and encourage them with confidence. Hey, sugar does not feed cancer. Let's keep your nutrition status up. And then ongoing support. That's going to be huge for cancer patients, is ongoing support to get real outcomes. Okay, so there's more questions. So how do you want me to finish? Like, you want me to just keep going through the questions? Like, how much time do we have? So I make sure I'm like respectful of the time.
Right, we have a couple more minutes. I'm just waiting on the Google form to be pasted into the chat. So we can keep going for a little bit.
Okay, cool. Okay, cool. So I'll keep going through these questions. How important is consistency for these patients? And how do you determine how long they should be on their diet? How do you handle patient deaths? And also, what other healthcare providers do you work with on a daily basis? Okay, so consistency is huge. A lot of the times what I see, and this might just be people in general, is they think they've got it. Oh, I got it. You know, I'm eating fine. No, side effects come up with cancer treatments. It is actually a win if they're maintaining their weight. It's a win if they're eating all the time, and we need to check in with them on that. And so consistency is key as the oncology dietitian. If they say, oh, I've got it, and then they're 3 weeks into these crazy side effects, they've been forgetting to eat, they've got diarrhea, and now they've just lost 10 pounds. Well, now you're going to have to play catch up, and they're probably feeling terrible. So you seeing them and keeping them consistent into eating, sleeping, exercising, even if they're doing, good, is key. How long they should be on their diet. So same cancer, same treatment regimen on one person is going to result in different side effects than another. Okay, so you really have to look at the individual. What are they up against? Maybe this person is actually doing pretty well on their chemo, colon cancer, stage 3, whatever their chemotherapy is going to be. They may be doing a lot better than this person over here. So maybe this person you can see bi-weekly, this person you can see, twice a week. You really have to look at the patient to see how long you have to emphasize based around the severity of their side effects. How do you handle patient deaths? So for me, well, I don't know how, I don't want to sound insensitive. It's really heartbreaking for me, but then it just kind of moves me. Yes, it's unfortunate, but then usually it's from, multiple factors. Usually malnutrition is mixed in. So I really become an advocate for the next patient. I just really try to move on to help the next patient so it doesn't happen to them. Because sometimes you'll have cancer patients come in and there's no way they're going to recover. They were misinformed and they're eating lettuce for weeks and they're dying. So you just really try to refocus back on helping the next person. It doesn't feel good. What healthcare providers do you work with on a daily basis? The doctors, the nurses, oncologists, the whole team. You work with the whole team because they need to know, like, what are the risk factors? Okay, we need to snag the dietitian for this new patient. But then also you as a dietitian will be screening the clients that come in. You'll be checking their weight, their changes, their weight history, their side effects. So you'll be able to kind of pinpoint who you need to see on a regular basis. And you can tell the team that too, like, excuse me, we got to make sure, I'm seeing this patient more often, if they don't have a stomach, gastrectomy or things like that. No, DNA testing to create a personalized diet. No, I don't do that. You don't need to do that. Risk factors for certain cancer, it's really, weight is huge. Alcohol, how much you're drinking, plants, exercise, that's going to be much more effective for cancer prevention than a DNA testing. I wouldn't even do those. What's the question for people with weight loss to say? Yeah, I think that's a scam. You're missing their marketing. you're missing the point. Like they market, it's so smart how they market, because people think, okay, if I get a DNA test, then I'm going to get this precise diet plan to follow. But that's just not reality. That's not how humans work. Like, we're so complex. No one fits into one meal plan. So, and they want a quick fix. That's why they do those tests or kits or fad diets, because they're like a quick fix. But then what ends up happening is they don't learn anything, and they just end up gaining back the weight, and they can't maintain it. You really need to show someone how to eat and live like for the next 20, 40 years. It takes time to build new patterns. How common is developing eating disorder in cancer patients? So common. I don't know. Like, I don't know the study. I don't know, but like, man, and the triggers, I'd almost say like 100%, but there's no articles on that. I can't say, but they'll have certain triggers. One client of mine, she lost weight right around, this is non-common, around the time of her diagnosis. And now every time she loses the weight, she like completely spirals with anxiety and has to learn that, no, this does not mean that I'm diagnosed with another cancer. Like, it's huge. So that's really cool about the oncology dietitian, is you can come in and educate them, so they don't develop those eating disorders. Mental breakdowns and develop food disorders while having cancer. Work with a dietitian. How can we manage patients going through mental breakdowns and then having food disorders while they need to work with a dietitian, like for real? So they need a therapist, number one, and they also need to be working with a dietitian at least once a week. How do you communicate with the patient's oncologist to let them know what you're doing for them? So it's just in the chart. So there'd be a section for notes for the dietitian that the team could access, and what you could just make sure to do is to either set up a way to communicate with the oncologist specifically for certain patients that stick out, or let people know, hey, this is where my notes are. Are there typical points in cancer treatment where you can expect the patient to decline in health? Yeah. So like 3 to 4 weeks into radiation, side effects will start in, and then chemotherapy as you progress throughout it. Into chemotherapy, it takes a few rounds, but you'll start to notice it becomes cumulative. The cells are starting to have a harder time rebuilding because they've been going through so many treatments, because chemo is essentially poison, right? So they may have a great first round of chemo or first 2 rounds, but that it's going to be cumulative and things are going to start deteriorating. So, and you can let them know that too, like, hey, it can get cumulative. Are we allowed to put the research bullet points here in the chat too? Yeah, I mean, if you guys need information, I can send it to whoever and you can have it shared on, or I can send it to YouTube. Yeah. Do pediatric patients typically reach that point of no return regarding malnutrition? They're better. They're better. I don't work as much with pediatrics during the malnutrition component. I'm not sure on that one as much. They eat better than adults, but still they have really difficult side effects. They have a lot of tube feeds with pediatric cancer patients, so that really helps. And then do you sit with the patients and debunk myths, or do you only volunteer the information when they ask? So definitely I have a screening process. I lead, you want to listen, but you can't just go in and be like, hey, how you doing? As the oncology dietitian, you have certain screening, what's your weight history? Do you have any anxieties or fears around food? How do you eat now? That's huge. When you ask them how you eat now and they say like, well, just lettuce, then you say, okay, why is that? What are the myths that you've heard? And then you're able to really go through them. Also, I do education a lot in my private practice about the myths. I do debunk them a lot. But you really just ask them and see where they're at. And they'll say too, they'll be like, well, I make sure to do free range organic, and then that's where you can come in and be like, hey, you do not have to do organic. You do not have to worry about GMOs. Did you know that? Did you know that frozen fruits and veggies have just as much nutrients as fresh? So you're able to tell a lot from what they tell you. So having a good screening process of open-ended questions for them will really help you be successful. And then how has COVID impacted my work? It has not actually, because I am a virtual oncology dietitian. If anything, I've been more busy because, because everything's virtual right now. So it's been the same for me. I see my clients virtually. And actually it's been cool because there's been cancer clinics that have reached out to me to do presentations because they haven't been able to have the dietitian in center. So it's been better for me. I've been able to reach more people. So I've been really happy with that. But my work is all virtual. I see clients all over the country. So it has not impacted me. So yeah, so it's been pretty good. So yeah, thanks.
That was the last question. Thank you for being here and for sharing this specialty. And I think it's really interesting, and I definitely learned so much, and I hope the viewers did as well.
Good. Thank you for having me. It was awesome. Appreciate it.
So I posted the Google Forms in the chat, and you would have had 30 minutes since it was posted. If you have any questions, please reach out through emails and social media and handles. And I'm just going to end this meeting. Thank you for being here again.